It's absolutely amazing. We found that if I lift my right shoulder and we like stabilize the shoulder, my C1 tilts less.
Hi, I'm Dr. Brian Hutcheson, and with me is Danielle, that many of you may already know from a video that we did over a year ago. So Danielle, thank you for coming back halfway across the world to spend some more time on your journey towards full healing.
3 airplanes to get here.
And how many hours?
Over 30 hours of traveling.
Wow. All the way from Hong Kong.
Yeah.
Okay, and so Danielle, your journey has been quite a long one. You had debilitating vertigo that had spanned over a period of 7 years.
8 years.
8 years.
Over 8 years.
Multiple different injuries that contributed to it. You used to be a competitive and on the world stage for what's called fell running or mountain running, if you're not familiar.
Yeah. I was
And
the best runner in Hong Kong and Wales.
that's amazing.
And since my injury, I haven't really run.
Okay. And, over the last year when you were here for a few months and you got a complex rehabilitative plan, you worked on the curve with me, we did adjustments, you did regenerative medicine procedures, and it was a tough journey, but you got to the point where your life was a lot better.
It took me over 7 months of treatment to be able to walk on sand.
Okay.
So it was very slow. I was slowly recovering, but it was a huge, huge difference between, when I left and when I came.
And now that you went back home and you've come back here, you know that you've gotten back to some regular things in life. But one of the things you've still not been able to do has been go to the gym or really get back into being fit, which is something that you love.
Yeah, I haven't been able to lift weights or lift my daughter.
Without getting a flare-up of symptoms, blood pressure irregularities, feeling a little bit of brain fog, still feeling like, you're not quite perfectly balanced.
Flutters.
Heart flutters. And something that we found yesterday that was really eye-opening and pretty amazing was that Danielle's C1 has been tilted her entire time since she started care. And she's gotten all of these treatments, like a lot of, regenerative medicine and curve correction and adjustments, and the C1 just kept tilting. So yesterday, tell everybody, what did we find yesterday?
It's absolutely amazing. We found that if I lift my right shoulder and we stabilize the shoulder, my C1 tilts less. So we could see on the x-ray, it's incredible.
So we found that when Danielle took her right arm across her left shoulder, the C1 tilting almost disappeared. So then we went in and examined her. I examined her shoulder and found that there was a lot of tendons that were frayed or damaged. And so we did dry needling to the right shoulder. You can see a couple of the little tiny marks still from yesterday.
Hurt that much.
It wasn't that bad. She tolerated it. She was amazing. And after we got done with the dry needling, one session to that shoulder, what did you notice?
I noticed when I looked in the mirror, both of my shoulders were level because usually one side is higher or lower. So they were level and I just felt like I had more energy and I didn't feel as dizzy. My vertigo was a lot better.
That's amazing. So you instantly felt like your shoulder got pulled up. It was more level. You said yesterday you felt a lot less tension in the neck. So the scalenes and the SCM were pulling less. You were holding your head better. You had more energy. And yesterday you went to the gym. You got dry needling done. We did adjustments. You went to the beach. You had a full day. And at the end of the day, how did you feel?
I felt really energized. I'm obviously jet lagged at the moment, but my head just feels a lot better and my neck just feels it's not as tight.
Good.
Yeah, my
So
vertigo's not as bad.
that's amazing. So you were able to do the gym after so many years of waiting to get back into the gym. And Danielle, we did a repeat x-ray today after one session of strengthening the tendons to reduce pulling, which effectively what was happening, everybody, just so you can realize, was the tendons in this area, and it wasn't even the ligaments. We didn't treat the ligaments. We treated the tendons, and they were not working correctly. So the weight of her arm was causing the shoulder to be pulled down, tightening all the muscles here, tilting C1, because there's many muscles in the neck that connect up to C1, the skull and the upper neck, from the scalenes to the SCM to the levator scapulae to the trapezius connects to the occiput, and it was pulling it out of position. After just one treatment of dry needling to those tendons, her shoulder is much more stable from a muscular perspective. Many people don't realize that stability is not just ligamentous, but our tendons and muscles, if they're frayed, they also can produce abnormal pulling, which causes, the term for it is still instability, but it's through tendons that have been damaged. If you watched one of the last videos that I did, I talked about how when you're in a car accident or you're in a sports injury, that you're usually actively engaged. Your muscles are firing.
Yeah.
And so when you get the limit of what your body can tolerate, it's first the tendons that get damaged, and once those go, then the resulting force goes to those ligaments. So just to recap, Danielle, you've already made it pretty far, but you weren't able to do exercise, and that's something that you love. So while you've gotten your day-to-day life back, like being able just to be present for your daughter, for your family, and do some simple chores around the house, you haven't been able to really do what you love, like I would say almost like your selfish thing that makes you better for other people. And what I mean by that is, for me, it's ice hockey. So when I go play ice hockey, it's not really helping anybody else. It's like my thing. But when I do that, I'm in a much better frame of mind. I feel better, and then I can be better to others. So
Yeah.
what we just found was that because your right shoulder was pulling tendonously through the musculotendinous junctions, which we rehabilitated or are rehabilitating with dry needling, we're able to reduce the tilting of your C1. And with that, you were able to perform exercises yesterday, go to the beach, walk on the sand, and have a full day, still feeling full of energy at the end of the day. So we want people to consider anybody that may be slow to recover when they're undergoing neck treatment, whether it be upper cervical chiropractic, physical therapy, regenerative procedures to the upper neck. If you're not getting the results that are expected, whether it's holding your adjustment for a certain period of time, or whether it's a reduction in instability per regenerative procedure that you're expecting, please look and reach out to us, because it could be something as simple as the tendons not cooperating and you getting abnormal pulling from your shoulder, from your clavicle, from another area in your spine that could be pulling C1 out of alignment, which is going to be fighting some of the other really important treatments that you're getting done.
Yeah, you're absolutely right. I've had this shoulder thing going on for about 10 years, 2 years before I had my neck injury. And I always thought, it's not important that I treat this. Let's just focus on the neck. And now I realize it's all connected.
You're exactly correct, Danielle. To notice that you had that shoulder injury even prior to your neck injury is an important part of your history for us to help you really fully recover. So thank you so much for sharing your story, and maybe we can do, I know it's hard for you to get here from Hong Kong, but maybe we could do a Zoom follow-up in a few months. I know that a lot of our viewers are always interested to see how people are doing down the line. So
We can do some remote gym training too.
good. Okay.
Yeah.
All right. Thank you. Okay. Thank you so much.
Thank you.
Okay. All right.